Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you've found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Okay, a big thanks to all of our followers. I hope you're finding our content helpful. I know I'm enjoying putting it together. I am all about helping people get more affordable health care and get control over the costs, get access to quality health care. There's a huge movement in the industry. I've been fortunate to be a part of that. So today, in the last episode, we talked about how an employer might look at our next generation healthcare services. When you really, in the real world, you get out there and evaluate that, how should you look at it? I mean, for years, insurance has been a safe harbor. So, gosh, here's something new. I don't know how I should perceive this. So you can certainly go back and look at that episode, but I'm going to switch gears a little bit. Today, I'm going to talk about how you as an employer should consider, what you should consider that your employees consider. What do they think about when they think about healthcare benefits? What do they want? So, I've worked for a number of jobs, just like most people. I worked for a lot of jobs where company provided healthcare services. And, hey, my kids were paid for. They were born and paid for by health insurance. And, it was great. I took it for granted, but I didn't take it for granted so much when I got the notices from the company that the rates are going up. And then over a period of time, I started to realize that I had more out-of-pocket expenses. I had to pay a bigger chunk of the medical charges as I utilized them. And that was concerning, but what the heck? I had a good job, so we just kept on going. We can cover that topic in more detail in future episodes, but it's up until the 1990s, it was a customary practice of insurance companies to allocate 95% of their total revenue towards claims payment. Beginning in the 1990s and since then, and if you've been around since then, you've seen this happen. We have migrated towards what's now called high deductible insurance. In other words, the insurance industry was focusing more on profits and stockholder dividends, and they started increasing the rates. Now, to keep that in perspective, to retain their clients, I should say, their corporate clients, their big corporate clients, they had to think of a way to mitigate that expense and pass that expense along to the corporate client without losing them. So they put together a scenario that kind of goes like this. Mr. Client, if you will increase the deductible to your employees by $500 this year, I will only increase your rates by 3%. And by the way, that's going to be a positive for you, because if that really makes it makes your employees part of the solution, because they'll be more diligent about how they've got buy-in. They'll be more diligent about how they use their health care and how they spend those dollars. So what we wound up with was insurance, what's called high deductible insurance, which a silver policy, which is a middle-of-the-road policy, is going to have a $5,000 or $6,000 annual deductible. There's only a few Americans, very few, that can come up with $5,000 on short notice. I mean, people just, in today's market especially, just don't keep that kind of cash around. 41% of Americans today have medical debt, and the leading cause of personal bankruptcy in America is medical debt. So here's the insurance industry inflating those costs to take on profit, and what's come out of this is that because they're the only game in town, they're the only way to get access to medical services, they have inflated the cost of medical services by 80 to 100%. This is a statistic we've talked about in previous episodes, and it's very real and it's very provable. But they've inflated the cost of medical services. So our entire concept is to move from that to a cash pay, to being a cash pay patient. And that is part of a huge movement in this country. When you begin to think about approaching your employees with this kind of change or with any kind of change, you've got to consider how they're going to take it. How do we do this? But you have to be diligent about the plans you put together. I mean, at the first of every year, or I should say at the end of every year, you have to make difficult decisions about your group health plan, which is going to kick off the first of next year. So you've got to strike a balance between taking good care of your employees and managing your company's expense, because every dollar you spend on healthcare benefits for your employees, you have to pass along to your customers. And so you have to be diligent about managing the expense of your products, because you've got other companies out there that are trying to steal your customers. So it's always a challenging time of year, and we're on that time of year right now. Let me share a couple of real life experiences that I've had. I'm going to talk to you about two different companies that I've engaged with in the past, and give you those scenarios so you can understand the difference between one extreme and the other. I was talking to a car dealer. He owns two car dealerships in Central California in smaller markets, not huge markets, but very successful dealerships. This was a really nice guy. He really felt like he was taking good care of employees, and he bragged to me about the fact that he pays for 100% of his employees' medical care, their medical benefits. And he went on to say, upon further investigation, he went on to tell me that they have a $7,850 annual deductible on their insurance plan. And I'm like, man, that's high. I mean, what that tells me is that's what's called a bronze plan. It's the least expensive insurance plan out there in the marketplace. But regardless of that, $7,850 is a lot of money. I mean, it's almost a catastrophic coverage policy. But he made a point of telling me that he has the same policy, so he pays the same $7,850 that his employees do. But what I knew that he didn't know I knew was he's in the process of building a multi-million-dollar beach home in San Diego, and his employees don't have that luxury. I mean, they're just trying to pay the bills, okay? So you have to ask yourself, how much benefit is a benefit that creates that type of medical debt for his employees? On the other end of the spectrum, I was working with a commercial electrical contractor in the Los Angeles market, and they were a non-union shop, but they had to compete against union shops. So to match that level of medical benefits that the unions provided, he was purchasing what's called gold and platinum level medical insurance plans for his employees. Now, with a gold or platinum level, that's an executive level plan that has virtually zero deductible and very little out-of-pocket, no co-insurance, et cetera. And obviously, they're very expensive. So I would, I had to share with him that's fine. I mean, that's what you felt you had to do. But I had to also tell him that his insurance agent was negligent, because he should have told him that he was purchasing too much insurance for his employees. I'm going to expand on this topic in a later episode and give you the details of it. But when I say purchasing too much insurance, people don't use all of their medical insurance benefits every year. They only have a medical emergency or, a major medical encounter every few years. So he's purchasing that coverage every year, and there's a different way you can do it where the employees can still have zero out of pocket, but have much lower insurance premiums. Let's talk about the challenges in implementing change. Even though employees don't like paying for insurance, if it was up to them, it would all be free to them, and the insurance would pay for all their medical bills, and they wouldn't have to pay anything. But that's not realistic. So whenever you face a change situation, if you're going to introduce your employees to next generation healthcare, it can be unsettling to the employees because insurance is a safe harbor. They kind of know what it is. They've had it for a long time. And here's this new thing they don't know about. So I think the first thing you have to do is really be tuned in and aware of what employees really want out of a medical benefit. This is very important. So I've got 10 points here, and I'm going to read them off for you so I get them right. The first, they want affordable monthly costs for their coverage. They want comprehensive coverage that meets all their needs, covers all their situation. They want fast access to medical services. They want flexibility to choose a plan that meets their specific needs. They don't want to be paying insurance premiums for services they will never use. Maternity might be a good example. A plan that lets them choose their own providers. No in-network, out-of-network providers. They have the flexibility to choose the providers that they want. They want affordable out-of-pocket expenses. Too often we gauge the cost of an insurance plan by how much the monthly premiums are, but that's really secondary. The real expense in an health insurance situation is how much you pay out of pocket when you actually obtain medical services. A plan with no surprises when the medical bills show up in your mailbox. And that's the Achilles heel of traditional insurance. That is why you can never estimate what a procedure is going to cost if you've got a traditional insurance plan, because there's always additional charges that show up that are totally unexpected. You want a plan with affordable coverage for your family members. It's nice that the employer gets you covered, but you'd like to, if you could afford it, you would also cover your family. A plan you can understand. With next generation healthcare, well, at first glance, people think it's difficult, but it's really not. It's far easier to understand than traditional insurance. It's just different. It's kind of like switching from an iPhone to an Android or vice versa. And here's the last thing, and it's something that if you ask the employees, they won't bring up because they really haven't considered it. But the last thing is you want control over your healthcare costs. You want control of your own healthcare. They've never had control of their own health care, so they don't know to ask for that or to make that a point. But I will tell you, looking from the outside in, you want control of your own health care. Let's face it, in today's world, when you have a plastic insurance card, you're at the insurance company's disposal. They will guide you through the entire process and tell you what to do and when to do it. So I want to give you two scenarios, and this is a little tedious perhaps, but let me walk through these two scenarios because it's really going to help you visualize what it's like to have insurance, what it's like to actually use insurance in a major medical situation compared to next generation healthcare in a major medical situation. So to establish some guidelines, again, I referred previously to metal categories with insurance. So you've got bronze, silver's the middle of the road. Everybody's got a silver plan, and then you've got executive plans, gold and platinum. We're going to be talking about silver level insurance plans in this conversation. When I refer to out-of-pocket expenses in my insurance example, I'm referring to a silver plan. When I refer to medical cost sharing, I'm referring to Sedera, which is the provider our company uses, because their sharing plan, their guidelines are substantially different. Many other cost-sharing companies, as good as they are, and there's really good ones out there, they structure their guidelines much like an insurance company does. They have annual equivalent to an annual deductible. They have networks, provider networks, etc. Sedera has none of that. So we're going to talk about it. When I refer to medical cost sharing, we'll be talking about how Sedera does it. Let's take a person who's got a silver plan with a $5,000 annual deductible, and that plan has a 30% coinsurance rate, meaning once you pay your $5,000, you're going to pay 30% of any additional charges until you reach your policy maximum, which is around $9,500, twice that much for a couple. And you've got a $60 copay. So when you go to the doctor's office, you pay the first $60, okay? So this person is experiencing some internal intestinal problems. There's pain, discomfort, whatever. They make an appointment with their doctor, primary care physician, and they have to wait 4 to 6 weeks, which is typical. In today's market, there's a shortage of primary care physicians. So you're going to wait 4 to 6 weeks to get in to see that doctor. So you wait that period of time and put up with all this discomfort. You pay your $60 when you check in, and your insurance company is going to cover the rest of that appointment. The doctor checks you out. He diagnoses that you potentially have diverticulitis. Now, many of you may not know what diverticulitis is. It's an intestinal inflammation thing. I'm going to use that because my oldest son had it a few years ago, so I'm kind of familiar with it. I'm no medical person, but I'll just use that as an example. I know what's involved in it, and it fits this scenario I'm looking at. So the primary care physician refers you to a specialist. Might be an internalist or a surgeon, but he refers you to a specialist. So you actually have to make another appointment or wait a few more weeks, and you go in to pay the same $60, and you get diagnosed, and the specialist diagnosed that in fact you do have diverticulitis, and based on the severity of it, they don't think they can handle it with medication, so they're going to recommend surgery to remove part of your intestine, your colon actually. So in preparation for that, they're referred to the hospital for the surgery. It's an in-network hospital for the insurance company, as were the doctors the 2 doctors that he previously visited with. So being a diligent patient, they ask for a quote from the hospital, and they're provided with that quote of what the expected services will cost, so they'll know how much their out-of-pocket expense is. Now, I have no idea what a surgery like this costs, but just for the sake of discussion, I'm going to take a nice round number like $20,000. Let's say that the quote was $20,000. So we go into this thinking, okay, $20,000 expense, and I'm going to pay the first $5,000. So when you get the bill, when it's all said and done, you've got $5,000. The insurance company pays the other $15,000. Well, not quite. Actually, you've got co-insurance of 30%, and 30% of $15,000 is $4,500. That makes your total expense $9,500 out of the $20,000 fee. Okay, so that's what it is. Now this all came down late in the year, let's say November sometime, and unexpectedly you had an extra night in the hospital. You typically spend 2 nights in the hospital, but you were running a fever, so the doctor wanted to keep you one more night to watch that. So you spent an extra night in the hospital. No big deal. You didn't even think about it. Short time after leaving the hospital, the bills start to arrive. And what the bill tells you that you didn't expect is that you have a $400 copay for that extra night in the hospital. You have a 20% copay for the imaging and lab work that went on during that period of time. You have additional physician consultation services during that extra time in the hospital. And although the hospital was an in-network provider, guess what? The surgeon that came in to actually do your work did not have a contract with your insurance company. There was no negotiated rate for that surgeon. So you were charged for out-of-network fees for the services of that surgeon, okay? You didn't expect any of that. One of the core tenets of next-generation healthcare is access to quality healthcare and control over the cost. The example I just shared is a realistic reflection of what happens with traditional insurance and why you're challenged to have the access you want, and you certainly don't have control over the cost. If you go out there and do a web search and say, why does insurance cost so much? Or why do people hate insurance? Obviously, I've done this. One of the top things on the list is going to be you never know what it costs. You'll never know what it costs until the bills show up in your mailbox. So let me take this example one step further. Now, we did that in November, late in the year, and in January, okay, we've got something going on here. There's maybe some complications or something. We have to go back for some additional lab work, examination, imaging, whatever. Not sure what it is, but they have to go back for related treatment. Your $5,000 annual deductible is started over again. So all of that expense up to $5,000 is on you. That's your expense. And you'll see why I make that point as we move on to next generation healthcare. Now, the same scenario as we previously used, we'll use the same thing with next generation healthcare, except with medical cost sharing, there's no annual deductible. There is an initial out-of-pocket amount that the member, we call it a member, it's not a policy, it's a membership. The member's responsible for an initial amount, the most common, and you choose the type of membership you want and determines what that initial out-of-pocket expense is. We call it initial unshareable amount, IUA. But let's say one of the most common plans or common memberships has a $1,000 IUA. So what happens is you come along and you have the same discomfort and everything, and so you call your physician, and within 48 hours, you're going to have an appointment, a consultation over the phone or video conference with your dedicated physician. That physician, based on the information you provide them, is going to tell you you've got a potential diagnosis of diverticulitis, and they're going to refer you to a specialist. Now you have to go see a doctor. So your medical support team at your virtual care provider, which is Lyric Health, is going to use a service called MD Save. That's one of the biggest databases of reduced price cash pay medical providers in the country, and it's huge because all doctors, just about 100% of doctors' practices out there provide reduced cash price services. I mean, they're required to by the government. So you go see an internist, you make that appointment through MD Save, and you go see that internist, and you pay for that. That bill is all yours. But instead of having a $200 appointment bill, you might pay, I don't know, I'm guessing $125. It'll be a reduced cash price. So come out of the specialist's office, and you know you've got diverticulitis, and you're going to need some surgery. So you contact Sedera. You've got one person there that you interact with. It's assigned to you. They're your support person, and they're gonna open a case and follow you step by step through this whole procedure. They're gonna hold your hand because they know you don't know how to do this, especially if you've never done it before. So they're gonna work with you all the way through this. If it's something that they consider serious enough, they're going to refer you to a second opinion service. You provide that second opinion service with all the diagnostic material you have, and they'll offer a second opinion. 35% of the time, a second opinion is provided. Either the diagnosis or the treatment plan changes. Now, Sedera does this because Sedera is interested in two things. Obviously, they're going to financially protect you from the expense of the medical service. But before they do that, they want to make sure that you're, number one, you've been diagnosed with the correct problem and that you have an appropriate treatment plan put together. And number two, they want to make sure that you receive that treatment at an affordable rate. Okay? Those are their two main concerns. So they're going to help facilitate all of that to the extent they'll get on the phone with providers. If they think you get a bill from the hospital that's has inappropriate charges on it, they're going to be on the phone to the hospital going through that and straightening it out. Okay? So during the check-in process at the hospital, you're going to make them aware that you're a cash pay patient and you expect cash pay rates. So upon completion of the surgery, you're going to obtain an itemized invoice and you're going to send that to Sedera. Sedera is going to process that, and they'll typically do it unless there's any complications. They're going to typically do that in less than 30 days, and they'll have a refund back to you of that entire expense, less your $1,000 initial unshareable amount. Now, that's why with medical cost sharing, with next generation healthcare, you can have control over the costs because you pay your first initial unshareable amount and the rest is covered. If there's an additional night in the hospital, which in this scenario there was, it's all covered. You don't have to pay a piece of that. You don't have to pay a piece of the lab work or a piece of the extra night in the hospital or the extra doctor bills. There's no in-network, out-of-network providers. You don't have to worry about a doctor coming in that may not be in-network because it's just paid for. That's the simplicity of it. And so you are reimbursed for the entire expense. And let's say you came back at the beginning of next year and you had those complications we talked about before. Guess what? There's no annual deductible with next generation healthcare. So when you've already paid your initial unshareable amount, and unless you go for 12 months with no diagnosis and no symptoms of this problem, you never have to pay that again. If you have additional treatment related to it, say you were in a car accident, you've got to have therapy or other surgeries next year or even the year after, you never pay that $1,000 amount again. It's all covered by your sharing community. The last point I want to make is you got to be thinking at this point in time, if you followed me through those two scenarios, you got to be thinking, what's the catch? What's going on here? What's the magic of it? How does this work? There's no magic. When you grasp that the insurance company inflates medical costs by 80 to 100%, now you're bypassing the insurance industry and going straight to the source of care. It's not hard to understand at all. It's simple math. It works. There's no annual price increases. You don't have to worry at the end of the year of what you're going to do with your plans. They just carry over and keep going. As long as you're paying what they call a contribution, it's not a premium like an insurance plan has. It's a contribution to the community. As long as you pay that, it goes on. The only time there's ever a price increase is when the actual cost of medical services increase. Those will be passed along. And that, historically, looking back at that happens every several years. It's certainly not annually. There's one other component. Let's change that scenario a little bit and say instead of an inpatient situation where you had to spend the night in the hospital, you had, a hernia operation or an ACL repair or something like that, something you could do with outpatient surgery. You could go in, surgical center, they'd do the surgery, and you go home that night. So what changes when you're working with Sedera? Well, guess what? Sedera has a relationship with a really unique company called Savos. That's Savvos, Savos Marketplace. They have a huge database of providers out there that provide all of these major medical services at reduced cash pay rates. And the reason Savos is able to get even lower rates than you might get if you go and just ask for cash pay is because Savos pays the bill to the medical provider the minute you walk out of that facility. They pay it right up front. Then you submit those bills to Sedera. They reimburse you. You reimburse Savos. It's an amazing situation, and there's no credit applications, anything. It just, as long as you're a member of Sedera Medical Cost Sharing Community, you got that service. So literally and here's the icing on the cake, so to speak. When you use Savos, here's the icing on the cake. Sedera this is such a benefit to Sedera and the cost sharing community that they waive up to $1,500 of your initial unshareable amount. So if you got a $1,000 IUA membership, you paid nothing, no out of pocket. You go get your outpatient surgery, treatment, whatever it is, you have no out-of-pocket expense. Now, where else will you find something like that? But it's all about managing the costs. It's not, you get the same health care from the same providers, the same doctors, everything is identical. It just costs less. And the medical community loves working with that. They love cash prices. They don't like messing with insurance companies. So, it's a huge benefit. As we wind down today, I hope you learned that the health insurance industry has taken control of our healthcare system and held consumers hostage until they pay exorbitant prices for services, all for the sake of corporate profits. And I don't want to beat up the insurance industry. But it's part of my DNA. I have to beat them up to some extent because they're not doing a good job for the consumers. There are certainly certain situations where insurance is the best solution, but I will say that next generation healthcare should meet the needs of the majority of consumers. Here's something else I want you to understand. Insurance plans have an arbitrary structure that is inconsistent with how we utilize healthcare services. What does an annual deductible or a copay have to do with how we actually use medical services? With medical cost sharing, you pay out of pocket when you use services. You don't have to pay $5,000 up front before that kicks in. You pay a very small amount, they pay the rest. If you have another major incident, you pay that small amount again, they pay the rest. And then there's a limit to that. There's only 3 times a year you have to do that. And after that, they pay 100%. So for most Americans, there's a better option for obtaining healthcare services that is not only far less expensive, but gives the consumer control over their healthcare. Again, consumers don't know what control over their healthcare means, but once you experience it, you will certainly appreciate it. As I close this episode, I want to urge each of my viewers to go to our resource page at optimaltelehealth.com. We've got all of our blogs and podcasts out there. There's download material that you can access, lots of information. And what's most important, and I urge you to do this, I'd love to hear from you. There's a comment section on there where you can send your questions, or if you think that I'm mistaken or I misrepresented something here, please tell me, because I always say I'm not an expert on anything. I just have a lot of knowledge about a lot of things. So tell me that I'm wrong, and I'll respond to you. And if it's appropriate for everybody, I'll even put it on a podcast and we'll talk about it openly. So we hope you found this episode informative. Until next time, remember, next generation healthcare fosters a brighter and more empowering future for all. Thank you.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.